Global News has learned a passenger on board a WestJet flight originating from Vancouver that landed at Winnipeg's airport was taken to hospital with a possible case of COVID-19.
A middle-aged woman exhibited symptoms that have led to primary screening for the virus. Now you can see in these photos submitted to Global News by one of the passengers, paramedics in masks and protective clothing on the flight. And a flight attendant on the WestJet plane also informed passengers of the situation.
We did have a guest who wasn't feeling well. Out of an abundance of caution due to the current climate, the current situation, the current things that are happening, we wanted to make sure that we covered our steps and that we contacted the public local health authority.
Here's Marty Blunt now with reaction from those on the flight.
It all happened on WestJet flight 448 from Vancouver to Winnipeg. It landed here at Winnipeg shortly after 2. Sources tell Global News a middle-aged woman who had recently traveled to China fell ill on the plane. Sources also say she exhibited symptoms that led to primary screening for COVID-19. Emergency crews were called. Here's what some of the passengers had to say.
I saw something before we landed in Winnipeg, and there seemed to be a woman having some problem. And so she got attended to right away by the cabin crew, and then the other two people stood up and left their seats and then they sprayed the whole area.
While the passengers waited on board for about an hour and a half, some saying they became restless.
They told us that we just had to stay seated for a while. Before that, they had told us that someone was ill on the plane and asked if there was any medical personnel. And then they just told us that we just had to wait, that they were going to get EMS on board.
Emergency personnel showed up, and then they took a lady off the plane, and then the ambulance was there, and then eventually everybody got off the plane.
The passengers were allowed off the plane around 4 and had gathered their luggage and left the airport shortly before 5. Marnie Blunt, Global News.
Now, Manitoba Health says it's aware of today's situation, but refused to give any specific details, saying only, "We can confirm that all appropriate precautions and procedures are being followed. Public health officials are monitoring the emerging and rapidly evolving situation related to COVID-19.
Now this coming after the province's chief medical health officer said earlier today the risk of COVID-19 in Manitoba remains low, but he says travelers need to stay cautious.
All returning international travelers should self-monitor for symptoms of COVID-19 for 14 days after their return to Canada.
Dr. Richardson adds travelers who do develop cold or flu-like symptoms should contact HealthLinks. So far, 38 tests for COVID-19 in Manitoba have all come back negative.